Stool, stuck in the rectum. What is it and what to do? It's a familiar and deeply uncomfortable experience for far too many people, yet it's something we rarely talk about openly. Perhaps you've spent what feels like an eternity in the bathroom, sitting there for 30, even 60 minutes, feeling an intense urge, a definite pressure, and a profound sense of discomfort, but nothing seems to happen. Your body just won't cooperate. You feel the presence of stool, you try to push, but it's as if an invisible wall is blocking the way. Eventually, you give up, utterly frustrated and defeated, telling yourself you'll try again later. But when later comes, the same disheartening struggle unfolds. This repetitive, agonizing experience, where stool simply won't budge despite your efforts, is often much more than just typical constipation. It's a sign that something more serious is happening, and it's likely not something a simple over-the-counter remedy or a quick home fix will resolve. My name is Dr. Michael Adeyemi, and today I'm here to shed light on what it truly means when stool becomes firmly lodged in the rectum. We're going to delve into why this condition is particularly serious, especially as we get older, and I'll walk you through, step by step, exactly what you should do. We'll be discussing the actual anatomy involved and providing real, actionable solutions. I understand that talking about bowel habits can feel uncomfortable, even a little embarrassing, but your health, comfort, and well-being are paramount, and they come first. If any part of this description feels even slightly familiar to your own experience, I encourage you to share your thoughts in the comments. You are certainly not alone in this struggle, and your participation helps others who may be silently suffering find this crucial information. Understanding what's happening inside your body. To truly grasp the gravity of this situation and what's unfolding within your digestive system, let's consider a vivid comparison. Imagine a long, majestic river that has flowed gracefully for many years. Its waters move steadily, nourishing everything downstream and ensuring a continuous, healthy ecosystem. Now picture what happens if, over the course of just a week, very gradually and almost imperceptibly, the river's flow begins to slow. Perhaps there's been an unusually dry spell, or maybe some natural debris, like branches and sediment, has started to accumulate in a particularly narrow bend. The river doesn't suddenly stop overnight. Instead, it decelerates, flowing slower and slower until one day, the debris has compacted so tightly at that specific bend that the water can literally no longer push through. This powerful image offers a striking parallel to what can happen inside your colon, and it perfectly illustrates the condition we're discussing, a fecal impaction. While fecal impaction is the precise medical term, I find that clinical language can sometimes diminish the true seriousness of what's happening. In plain, easy-to-understand terms, it means a large, hard mass of stool has become stuck in your rectum, the final section of your large intestine, making it impossible to pass through normal bowel movements. Your large intestine, often simply called the colon, is essentially a long, muscular tube. Its primary and vital function is twofold. First, to systematically move waste material toward the exit point, and second, to absorb water from that waste material as it travels. Under normal, healthy conditions, this is an incredibly efficient and largely automatic process. Waste moves along, water is absorbed, and the stool maintains a soft enough consistency to be passed comfortably and without strain. However, here's where the natural process of aging can significantly alter this delicate balance. And this is a critical point that I want every person over the age of 60 watching this video to truly understand and internalize. As we gracefully age, several profound changes often occur simultaneously within our digestive systems, all of which can contribute to the development of a fecal impaction. Firstly, the muscular contractions that are responsible for propelling waste through the colon, those rhythmic, wave-like squeezes known medically as peristalsis, tend to slow down. Think of it like the river losing some of its natural current. Secondly, the intricate network of nerve signals that meticulously coordinate these contractions can become less efficient and responsive over time. This means the communication system that tells your colon what to do isn't quite as sharp as it once was. Thirdly, our natural sensation of thirst can decrease with age, leading many older adults to be chronically, albeit mildly, dehydrated without even realizing it. This lack of adequate fluid intake pelvic directly impacts stool consistency, making it harder and drier. Compounding these natural age-related changes are the effects of various medications. Many common prescriptions that are absolutely vital for managing health conditions in older adults can unfortunately have constipation as a direct side effect. We're talking about blood pressure medications, certain iron supplements, calcium channel blockers, and various types of pain medications, particularly opioids. If you are taking multiple medications, which is very common among my older patients, the combined constipating effect can become quite significant. When you put all of these factors together, slower muscle movement, less efficient nerve signals, subtle dehydration, and medication side effects, you create the perfect internal environment for stool to move through the colon far too slowly. This allows it to sit in the lower segments of the intestine for an extended period, losing too much moisture along the way. Gradually, it transforms from something soft and manageable into something hard, dry, and essentially immovable. By the time it has been sitting for 5, 6, or even 7 days without fully passing, it has dehydrated into what can only be accurately described as a dense, solid mass. And when that hardened mass finally reaches your rectum, the final storage section just before elimination, and it simply cannot fit through the narrow passageway, that is precisely when you have a fecal impaction. The intense pressure you feel is undeniably real. The sheer exhaustion and frustration from relentless, ineffective straining are also very real, and the deep-seated fear that something is seriously wrong inside your body is completely justified, because indeed something serious is happening and requires attention. If you're gaining valuable new insights from this discussion, please consider supporting this information by giving this video a like. The hidden dangers. Why this is far more serious than you think. I want to dedicate a significant amount of time to this particular section because this is the aspect that often catches people completely by surprise. When individuals hear the term constipation, their minds typically go to an inconvenience. Something uncomfortable, yes, but generally harmless and temporary. A fecal impaction, however, is neither an inconvenience nor harmless. It is a serious medical issue that demands prompt attention. Let's walk through the cascade of events that can begin to unfold inside your body when a large, hardened mass of stool becomes firmly lodged and stuck in your rectum for an extended period. The first major issue revolves around sheer structural pressure. Your rectum is an incredibly flexible structure designed to expand and contract. However, it is not engineered to indefinitely hold a cemented, dehydrated mass of stool. It has very definite limits. When the rectum is chronically overdistended, stretched well beyond its normal capacity by an impaction, the blood supply to the delicate tissue lining its walls can become compromised. These cells that form the rectal lining are living tissue, and just like any other cells in your body, they absolutely rely on a consistent flow of oxygen and vital nutrients delivered by the blood. When this crucial circulation is cut off or significantly reduced for too long, these cells begin to struggle. In more severe or prolonged cases, this lack of blood flow can tragically progress to actual tissue injury, sometimes requiring specialized medical intervention to repair. Now, here's a fact that genuinely surprises most people when I explain it during a clinic visit. Your rectum and your urinary bladder are very close neighbors within your body. They share an incredibly confined space within the pelvic cavity, separated only by a relatively thin, fibrous wall. Therefore, when your rectum is packed full with a solid, rigid mass of impacted stool and stretched far beyond its normal, healthy capacity, it physically pushes and presses against the adjacent bladder. For women, this pressure can often be even more pronounced due to anatomical differences in the pelvic region. What patients frequently experience as a result is a sudden, confusing, and often distressing difficulty with urination. They might describe a constant feeling of needing to go to the bathroom, but when they try, they only manage to pass a few painful drops, or in severe instances, they may be completely unable to urinate at all. I have had numerous patients arrive in my clinic genuinely convinced they had developed a severe bladder infection overnight, only to discover that the true underlying cause was a significant rectal impaction compressing their bladder from behind. Once the impaction was successfully addressed and cleared, the distressing urinary symptoms completely resolved. But we are not finished yet. There is one more critical symptom that I absolutely must warn you about, specifically because it can cause such profound confusion that people actually end up making the situation dramatically worse. This symptom is called overflow incontinence, and on the surface, it looks, sounds, and feels exactly like diarrhea. Here's precisely what happens. The hard, solid mass of impacted stool creates an impenetrable blockage, effectively plugging the main exit route from your rectum. However, higher up in your digestive tract, your intestines are still diligently producing new liquid waste. Because the primary exit is blocked, this liquid waste has nowhere to go except to gradually seep around the outside edges of the hard blockage, much like water finding a small crack in a dam and slowly leaking through. This liquid then unpredictably leaks out from the rectum. When people experience this liquid discharge, their immediate and understandable conclusion is, well, I clearly don't have a blockage, I'm experiencing diarrhea. And tragically, some individuals will then go to a pharmacy and purchase an anti-diarrheal medication, believing they are treating the problem. This is, without exaggeration, one of the most dangerous mistakes you can make in this specific situation. Anti-diarrheal medications are designed to slow down or even temporarily paralyze the natural muscular movements of your intestinal walls. By taking them, you inadvertently shut down the very mechanism your body is desperately trying to use to work around the existing problem, and you will effectively cement that impaction even more deeply and firmly into place, making it even harder to dislodge. I strongly recommend that you save this video right now. You might not need this information today, but if this scenario ever occurs for you or someone you deeply care about, having this step-by-step guide readily available could truly make all the difference. If you are experiencing what appears to be diarrhea alongside days of feeling like you cannot fully empty your bowels, please consider the very real possibility that it is overflow incontinence, not true diarrhea, and do not self-medicate it without speaking to a qualified doctor first. Why older adults face dramatically higher risks. I want to speak very directly and empathetically to my older adult viewers here because the statistics surrounding fecal impaction are quite sobering, and this critical topic is unfortunately rarely discussed in mainstream health content. Fecal impaction is not a condition that affects all segments of the population equally. Quite the contrary, it disproportionately impacts adults over the age of 65, and the risk of developing it increases significantly with each passing decade of life beyond that. In specific settings, such as nursing homes and long-term care facilities, some comprehensive studies suggest that fecal impaction affects a staggering upward of 40% of residents at any given time. This makes it one of the single most common gastrointestinal emergencies encountered in geriatric medicine. Yet, despite its prevalence, it is also one of the most preventable conditions when individuals are properly informed about what factors contribute to the risk in the first place. Let me outline the major risk factors that are particularly specific and relevant to older adults. Firstly, reduced mobility is an enormous contributing factor when we move our bodies, whether through walking, engaging in light exercise, or even simply standing and performing routine housework. We are mechanically stimulating our digestive system. The subtle rhythmic pressure created in the abdomen during even the simple act of walking plays a vital role in helping to keep intestinal contents moving along smoothly. When mobility decreases due to conditions like arthritis, recovering from a recent surgery, the aftermath of a fall, or any other physical limitation, that essential mechanical stimulation diminishes significantly. As a direct consequence, the colon's natural rhythm slows down, making it easier for stool to become stagnant. Dietary changes represent another key factor. Many older adults find that their appetite naturally decreases over time, leading them to eat smaller meals. They may also unknowingly consume less fiber, which is crucial for adding bulk and softness to stool. Furthermore, they may drink less water, partly because the natural thirst mechanism that signals dehydration becomes less reliable and less potent with age. All of these combined dietary and fluid intake changes reduce both the necessary bulk and the vital moisture content of stool, making it much more prone to hardening and becoming difficult to pass. Then there are the medications, a point I cannot stress enough. This is a conversation I strongly encourage every person over the age of 60 to have openly and honestly with their doctor or pharmacist. Many of the most commonly prescribed drugs for older adults have constipation as a direct, known side effect. This includes opioid pain medications, certain types of antidepressants, antihistamines, iron supplements, calcium supplements when taken in high doses, and diuretics, which increase fluid loss from the body. If you are taking multiple medications, a common scenario for many older patients, the combined constipating effect can become incredibly significant and easily lead to problems. Finally, there is the often overlooked issue of suppression. Many older adults grew up in an era where discussing bowel habits was considered deeply taboo or impolite. As a result, they may feel the urge to defecate but choose to suppress it because they are not at home or it's simply not a convenient time or place. They consciously wait. Repeatedly suppressing that natural urge over months and years gradually retrains the rectum to become less sensitive to the signals that indicate it's time for a bowel movement. The urge becomes less frequent, less urgent, and consequently, waste material sits in the rectum for longer and longer periods, drying out and hardening. Understanding your own specific risk factors is the absolutely crucial first step toward preventing this distressing situation from ever repeating itself. Before we dive into the exact step-by-step solution, please ensure you are watching this in a quiet place where you can fully focus, because the information I'm about to share could genuinely help you avoid a very unpleasant and potentially serious emergency room visit. Immediate steps for relief. The emergency action protocol. All right, you now have a comprehensive understanding of what a fecal impaction is and why it happens. Let's move immediately to the practical side, what exactly you should do if you find yourself in the middle of this challenging situation right now. The very first and perhaps most critical instruction I want to give you, and I want you to hear this with absolute clarity, is this: stop straining. I know it feels completely instinctive. I know your body is screaming at you to just push harder, push more forcefully, try a different angle, or change position. But here is the physiological reality of a fecal impaction. A solid, dehydrated, impacted mass of stool does not respond to pressure from above in the same way that normal, soft stool does. It is simply too rigid, too firm to be pushed out by force alone. What additional, aggressive straining actually accomplishes is a significant increase in the risk of causing other painful and serious complications. These include developing or worsening hemorrhoids, creating painful anal fissures, small tears in the delicate tissue around the anus, or even, in rare but serious cases, a condition called Valsalva syncope, a sudden and dangerous drop in blood pressure caused by excessive straining, which can lead to fainting. For older adults, particularly those with pre-existing cardiovascular conditions, aggressive straining can also place dangerous and unnecessary stress on the heart. So the first step is to stop straining, take a few deep, calming breaths, and let us work through this situation systematically and safely. Step 1. Glycerin suppositories. Your first immediate action should be to go to any pharmacy where no prescription is needed and purchase adult glycerin suppositories. For a truly hardened impaction in an adult, a single suppository is often insufficient. In consultation with a healthcare provider or following established clinical guidance, many practitioners recommend using 2 to 3 adult-strength suppositories simultaneously for an established impaction. Here is exactly how to administer them for maximum effectiveness. 1. Position yourself correctly. Lie on your left side. This is crucial. Not on your back, not sitting upright, but specifically on your left side. This position works synergistically with your natural anatomy, particularly the gentle curve of the sigmoid colon and rectum, to help direct the medication precisely toward the impacted mass. 2. Lubricate generously. Before inserting each suppository, apply a generous amount of water-based lubricant. Do not skip this vital step. The surrounding rectal tissue is likely already irritated, inflamed, and highly sensitive due to the impaction. Proper lubrication makes insertion far more comfortable and significantly more effective. 3. Insert gently and deeply. Gently insert each suppository as deeply as you comfortably can. Breathe slowly and steadily throughout the process. 4. Crucial waiting period. And this is the part where most people, in their understandable urgency, often fail. Do not move. Stay on your left side. Remain as still and relaxed as possible. Set a timer for a minimum of 30 to 45 minutes. Glycerin works by drawing moisture into the stool from the surrounding tissue through a process called osmosis, and by simultaneously lubricating. All of your at-home attempts have been thorough and systematic, and I want to emphasize the word thorough because patience is truly a key component of this process, and yet they have been unsuccessful. Then it is absolutely time to seek professional medical attention. This is not a sign of admitting defeat. Rather, it is making a smart, rational, and responsible medical decision to protect your health. At an urgent care facility or an emergency room, the clinical team has access to more powerful tools and expertise. They can provide high-volume therapeutic enemas with medicated solutions that are designed to penetrate much more deeply into the colon than anything available over the counter. They also have imaging capabilities such as X-rays to accurately assess exactly how extensive the impaction is, and to determine whether it extends beyond the rectum into the sigmoid colon, or even further up the digestive tract. In cases where clinical enemas prove insufficient, and this does occasionally happen, particularly with long-standing or very severe impactions, a specialist physician will perform what is known as manual disimpaction. I want to be completely straightforward and transparent with you about this procedure. It is exactly what it sounds like: a trained physician utilizing protective gloves and substantial medical-grade lubrication manually breaks up and carefully removes the impacted mass piece by piece from the rectum. Because the surrounding tissue is typically extremely inflamed and sensitive by this stage, this procedure is commonly performed under some form of sedation or regional anesthesia to ensure your comfort. While it might sound uncomfortable to hear about, I assure you it is a safe, routinely performed clinical procedure, and the immense relief patients report immediately afterward is, without exception, truly extraordinary. Your path to recovery and what happens next. Once the fecal impaction has been successfully cleared, whether through your diligent efforts at home or with the skilled assistance of medical professionals, your body will naturally enter a brief but important recovery phase that requires your attention, patience, and care. For the initial 24 to 48 hours following clearance, the rectal tissue will likely be irritated, somewhat swollen, and highly sensitized. It is perfectly normal to experience some discomfort, possibly a small amount of light spotting or bleeding, or a general feeling of rawness. Please know that this is an expected part of the healing process and will gradually resolve with time. To significantly alleviate discomfort and promote faster tissue healing, I highly recommend taking warm sitz baths. This involves soaking the lower portion of your body in a shallow tub of warm water for 10 to 15 minutes, 2 to 3 times a day. The warm water soothes irritated tissues and encourages blood flow to the area. Your dietary focus for the first few days post-impaction should emphasize easily digestible, soft, and naturally fiber-containing foods. Think comforting oatmeal, well-cooked vegetables, ripe bananas, and broth-based soups with soft, tender vegetables. It is crucial to avoid anything that is dry, tough, or inherently low in moisture during this initial recovery period, as these foods could potentially exacerbate irritation or contribute to further hardening. Most importantly, commit to drinking water consistently and deliberately throughout the day, even if you don't feel a strong sense of thirst. Gentle hydration is key to preventing a recurrence. This period, while the memory of the impaction experience is fresh and vivid, is also the ideal moment to make some crucial appointments and proactive health decisions. Book a visit with your primary care physician specifically to review your entire medication list. Discuss with them any potential constipating side effects and explore if there are alternative medications or strategies to mitigate these effects. If constipation has been a recurring and troublesome pattern for you, do not hesitate to ask your doctor for a referral to a gastroenterologist. This specialist can conduct a more formal evaluation of your colonic motility and overall digestive function to identify any underlying issues. Furthermore, if you haven't had a colonoscopy within the recommended time frame for your age and risk factors, this is an incredibly important moment to ensure that any potential structural causes for your bowel issues, such as a narrowing of the colon or a growth affecting the passageway, are properly evaluated and ruled out. Taking these proactive steps now can save you significant discomfort and worry down the road. Building a foundation for long-term health, long-term prevention. I want to conclude our discussion today by imparting the most important message I can possibly share with you. Everything we have discussed up to this point, the steps for relief, the emergency protocol, has primarily focused on crisis management. And while crisis management is critically necessary when an impaction occurs, it should never be our ultimate goal. Our true and overriding objective is to empower you to build a life in which this distressing crisis never, ever happens again. Long-term prevention of fecal impaction, especially for older adults, rests firmly on 4 fundamental pillars of health and lifestyle. Pillar 1, consistent hydration. Water is, without a doubt, the single most powerful and effective tool your colon possesses for keeping waste material soft, pliable, and easy to pass. Aim for at least 6 to 8 glasses of plain water per day. If drinking plain water feels challenging or unappealing, remember that warm herbal teas, nutritious broth-based soups, and water-rich fruits and vegetables like melon, oranges, and cucumbers all contribute significantly to your daily fluid intake. Consider setting gentle alarms on your phone or using a dedicated water bottle to remind yourself to drink regularly throughout the day. Make hydration a deliberate, non-negotiable habit. Pillar 2, regular movement. You absolutely do not need to embark on a marathon training regimen or engage in high-intensity workouts. A simple 20 to 30-minute walk each day is genuinely one of the most powerful and beneficial things you can do for your overall digestive health. Physical activity gently stimulates the intestinal muscles, encouraging peristalsis and promoting regular bowel movements. If walking is difficult due to arthritis or other physical limitations, even gentle chair exercises, arm and leg movements while seated, or swimming can effectively help maintain intestinal motility and support healthy digestion. Pillar 3, dietary consistency and fiber focus on incorporating adequate amounts of soluble fiber into your diet, which is found abundantly in foods like oats, fruits, especially berries, apples, and pears, legumes, beans, lentils, and thoroughly cooked vegetables. Soluble fiber acts like a sponge, adding crucial bulk to your stool and retaining moisture, which keeps it soft. If you are not accustomed to a high-fiber diet, introduce fiber gradually over several weeks to avoid potential gas and bloating. Furthermore, try to establish consistent meal routines. Eating at roughly the same times each day helps your intestines develop a predictable rhythm and pattern of activity. Pillar 4, scheduled bathroom time. Your body has a natural reflex known as the gastrocolic reflex, which is a signal your colon sends to prepare for a bowel movement after you eat. This reflex is typically strongest in the morning, often within 30 to 60 minutes after you've had breakfast. Make it a routine to sit on the toilet at this specific time every single morning, even if you don't feel an immediate urgent need to go. To optimize your body's position for elimination, use a small footstool to elevate your feet slightly. This helps to straighten the angle of your rectum. Give yourself a dedicated 5 to 10 minutes without rushing, without straining, and without distraction. Over time, your body will gradually relearn and reestablish this healthy rhythm. A crucial warning here: do not rely on stimulant laxatives as your primary or long-term solution for bowel regularity. I understand their appeal. They work quickly, they're accessible, and they provide immediate relief. However, long-term daily use of stimulant laxatives trains your colon to become heavily dependent on this artificial stimulation. When you eventually stop taking them, your colon has largely forgotten how to initiate movement on its own, leading to a condition known as cathartic colon. This is a real and documented consequence of long-term laxative overuse, where the colon's natural muscular function is significantly impaired. There are far safer, more sustainable alternatives available, such as osmotic agents, which draw water into the bowel, stool softeners, and fiber supplements. Your doctor or pharmacist can help you explore and recommend these options as part of a personalized, sustainable plan for long-term bowel health. I know this has been a comprehensive conversation today, and I understand that some of the topics we covered might not have been easy to listen to. However, I believe profoundly that the most important health conversations we can have are often precisely the ones that feel the most uncomfortable. You deserve to fully understand what is happening inside your own body when symptoms arise. You deserve a clear, actionable plan when something goes wrong. And perhaps most importantly, you deserve to know that whatever you are going through right now, you absolutely do not have to figure it out alone, and you certainly do not need to feel embarrassed or ashamed about it. If you found today's video genuinely useful and informative, I have one simple request. Please share it. Send it to a family member, a friend, a neighbor, or anyone in your life who might be quietly suffering with these issues and not saying a word about it. This video could very well be the exact resource they have been searching for, but didn't know how to ask for. Click the like button if this information helped you, and subscribe to the channel so you never miss our upcoming videos focused on digestive health, longevity, and taking real, proactive control of your health as you age. Take care of yourselves, remember to drink your water, keep your body moving, and I will look forward to seeing you in the next one.